Yo, I know that it feels like we just got out of the last one, and for some of you, it's still not even over, but it is well past the time to start thinking about the next global pandemic. Right? Because as the World Health Organization's Director General put it, this is not a question of if, but when. Right? With one study even estimating that in any given year, the chance of a pandemic similar to COVID-19 happening is about 1 in 50. And so that means that people will have about a 38% chance of living through one in their lifetime. And the thing is that yearly probability may as much as triple in the coming decades. But also, that study is optimistic compared to one conducted by this disease forecasting company in London. With that, putting the odds of a COVID-like pandemic occurring again by 2033 at 27.5%. Though, if humans prepare well enough, the researchers say we could cut that risk down by as much as 70%. But the real million-dollar question here is exactly which disease will spark the next outbreak. And with that, for the past 2 years, over 200 scientists have been studying this question for the World Health Organization, them evaluating the evidence on 28 virus families and one core group of bacteria encompassing 1,652 pathogens in total. In their recent release report, they identified more than 30 priority pathogens that they believe could trigger the next pandemic, which is very notable because that is a huge jump from the roughly 12 pathogens they picked out the last time this exercise was done in 2017 and 2018. And so this new list includes some old pals like the coronaviruses responsible for the last pandemic and Middle East respiratory syndrome, as well as some new characters like influenza A, specifically the bird flu.
Health officials keeping close watch on how much and how fast it's spreading.
Monkeypox.
The World Health Organization declared it a global health emergency.
And dengue fever.
Up more than 230% from last year.
And then, of course, there's Disease X, which sounds really scary, and it may or it may not be. It's just the WHO's placeholder term for any pathogen that we've never seen before, either because it doesn't exist yet, or it's hiding somewhere in the world that's under monitor. Probably a resource-scarce yet biodiverse region, which might harbor novel pathogens that are just waiting for humans to come along and chop down the rainforest so they can get out. Now, though obviously the features of Disease X are only hypothetical, we can make some guesses based on how diseases usually become pandemic. So, for example, it'll probably be a virus, it'll probably spread through respiration, and it'll probably jump from an animal to a human. Though it could also be a pathogen already in humans that just mutates to become much more transmissible, which, really in either case could be the stuff of nightmares, right? Certain viruses like H5N1, Nipah, and Ebola, for example, they're many times more fatal than the coronavirus, but luckily right now they're not very transmissible. But if one of those suddenly spreads super fast, it's a fucking nightmare. And so how do we prepare for a disease we haven't even identified yet? Well, the World Health Organization came up with a solution that it calls prototype pathogens. Right? Basically, these are single pathogens that are meant to represent entire families of pathogens. So in theory, scientists can prepare for each of those, and then hopefully when Disease X does emerge, it'll be close enough to one that we already have. And notably, this is not a new strategy. In fact, it kind of worked for COVID-19. Right? Because of what was learned during the MERS epidemic in 2012, BioNTech and Moderna had a COVID vaccine candidate ready within days in 2020. Specifically, they better understood how to stabilize the spike protein so it produced the appropriate antibodies. And maybe if we had also done even more basic R&D for the family of pathogens in general, we might have been more prepared for the outbreak. Because it's not just vaccines that we can get a head start on. Scientists are also aiming to develop broad-spectrum antiviral drugs and monoclonal antibodies. And to further those efforts, the WHO is seeking to establish a global collaborative open research consortium of each pathogen family. So hopefully, researchers from all different parts of the globe could put their giant brains together and share knowledge. Also, notably, the WHO's 194 member states were supposed to wrap up 2 years in negotiations on a historic pandemic preparedness treaty back in May, but thanks to disagreements mainly between rich and poor countries over financing, enforcement, and intellectual property rights, there's still no deal. Meanwhile, in April, the Biden administration released its new global health security strategy, a plan that's meant to roll out over the next 5 years, with it announcing that the US has expanded its health security partnerships from 19 countries to 50, which in theory would make cooperation on testing, surveillance, and pandemic preparedness generally easier. But pretty much everything that we've talked about so far are just the preconditions for an effective pandemic strategy, which consists of 3 things: prevention, detection, and response. Right, so the first step, prevention, basically entails doing everything we can to make disease outbreaks less frequent, which generally means reducing or controlling all the ways that humans fuck with nature, like deforestation, mining, disruptive land use, the wildlife trade. Because when we encroach on or destroy animals' natural habitats, that brings more of them into contact with more of us. Also, it stresses them out, which then makes them more likely to get infected with viruses and spread them to us. One obvious solution is to stop doing that. Or if we are going to keep doing it, at least regulate hygiene standards at wet markets like the now infamous one in Wuhan. Also, it would be great to reverse climate change. But let's say we do all that and an outbreak still occurs anyway. What then? Well, that brings us to phase 2, detection. Right? The sooner that you identify the emergence of a new disease and the better you track its spread, the easier it will be to contain. And the soldiers on the front line for detection are emergency room physicians, right? Because that's the first place people go when they're experiencing strange symptoms. But hospitals in poor countries simply don't have the same diagnostic testing capabilities that rich ones do. So it's harder to tell if a disease is something new or more of the same, which is why experts argue that rich countries have an interest in helping poor ones build genomic sequencing facilities. Because the sooner that you can sequence a novel virus, virus, the sooner you can design tests and vaccines for it, and the sooner you can hunker down before it reaches your country. But that can't happen if the country sequencing the pathogen keeps its discovery hidden from the rest of the world, a la China. So establishing open lines of communication and norms of data sharing between hospitals and governments, that's crucial. Right? Even within the United States, after COVID hit, state governments didn't always share their data with the federal government, which made it harder to get a big picture view. Also, another part of streamlining the detection process is making sure you have abundant quality data as soon as possible. And so you see experts pushing for a national readiness plan that includes the diagnostic industry and test manufacturers, the FDA and the CDC, private insurers and Medicaid, pharmacies and community centers. Because you don't want to be negotiating contracts and figuring out who's doing what in the middle of a crisis. It's better to have this stuff settled in advance. But in the event that prevention fails and containment does not work, you move on to step 3. Response. And I really don't need to tell you what that means because you lived through it, right? The lockdown, school closures, remote work, social distancing, contact tracing, etc., etc. And if we dipped our toes into the debate over how effective each of those policies were and what we should have done differently, we would be here for another hour. So instead, I want to focus on some of the straightforward stuff that we could do right now to make the next pandemic response easier. Starting with a really simple one, increase funding for public health. Right, what we often see is that money actually does solve almost everything. Whether it's shoring up hospital capacity, ending the healthcare workers shortage, or stockpiling equipment like ventilators. Also building up domestic manufacturing capacity for stuff like masks would insulate the United States against supply chain bottlenecks outside its borders. Then we could update building codes and subsidize property developers and owners to install better air filtration systems everywhere. Finally, there's the capstone to any good pandemic response, a vaccine. Right, as impressive as the rollout of the COVID shots were in wealthy countries, it took years for the rest of the world to obtain doses, which they largely got through philanthropy. So you have experts proposing that building up local manufacturing capacity in poorer parts of the world and training people now and then waiving intellectual property rights so they can have access to the recipe, that's the trick. Though, as we've seen with the struggle over the Pandemic Preparedness Treaty, that seems unlikely to happen. But at the very least, we can look forward to science and technology getting progressively better between now and the next pandemic. The Coalition for Epidemic Preparedness Innovations currently gunning for a 100-day vaccine development timeline using rapid response vaccine platform, which, I mean, even if they accomplish anything close to that, that would be breathtaking. Or to put that into perspective, it took 326 days for the first coronavirus vaccine to get developed and approved. But if we want to muster the political will to do any of this and ensure that ordinary people cooperate with public health measures, we need to restore trust in public health, right? Because when a pandemic strikes, it doesn't matter how many masks, tests, and vaccines you mass produce if nobody wants to use them. And right now, trust in public health is at a historic low because, as the saying goes, the only thing that spreads faster than a virus is misinformation. So in a sense, addressing the anti-vax sentiment and misinformation in general, that is the pandemic before the pandemic. And this is the further our world slides into ecological crisis, the more urgent all of this is going to be, right? Because humanity is at the same time more vulnerable to infectious diseases and more capable of handling them than ever before, right? Diseases can count on the interconnectedness of our world economy and the damage wrought by climate change to help them spread. But humans can hopefully count on our public health system's amazing medical technology and ability to adapt and innovate to keep ourselves safe. So the big question is, will we commit the resources needed to tilt the global balance in favor of humanity? Or will we just neglect our collective responsibility until the next disaster blindsides us?